Hi, and welcome to Speaking of Health, a place where you can learn to live a longer and healthier life. I'm your host, Jason Howland, and our topic today is carotid artery disease and stroke. And joining us is Dr. Philip Vuocolo, who's general vascular surgeon and also President and Chief Executive Officer at Fairmont Medical Center. Thanks for joining us today, Dr. Vuocolo.
My pleasure, Jason. It's great to be here with you.
Well, before we get into today's topic of carotid artery disease and stroke, we want to talk a little bit about health reform, and not so much the buzzword that we hear in Washington, but actually people reforming their own health, and that's what Speaking of Health is all about, right?
Right. I think it's very clear that the traditional role of the physician as someone who takes care of ill patients is changing, and really the focus for the future is going to be keeping people healthy. One of my passions has always been educating patients. I think it's very important to make sure that we do the best job as physicians to educate patients so that we can minimize their disease, the severity and the duration, and help people live longer, healthier lives.
It's probably a lot to do with prevention, too, and lifestyle choices with patients, right?
That's correct. Prevention is obviously a key in keeping people healthy, and certainly that's, again, going forward, one of the most important aspects of medicine for the future.
Well, we want to talk today about carotid artery disease and stroke, and I know it's something that you're also passionate about as well as a general and vascular surgeon. Carotid artery disease, what exactly are the carotid arteries? Because, you know, I think a lot of people hear about coronary arteries, but carotid arteries we don't hear so much about.
That's right, and that's really unfortunate. I particularly like taking care of patients with carotid artery disease because we can do such a good job in improving their health and keeping them healthy. The carotid arteries are arteries that quite simply start in the chest and take blood from the main vessel in the chest to the brain. When these arteries get plugged, that's called carotid artery disease, and that occurs from a disease process called atherosclerosis, which is hardening of the arteries.
So how does it happen? How do these arteries get plugged? Is it something that just happens, or is it something that you're eating? Or
Well, actually, there's a lot of different reasons that the arteries can get plugged. The most common cause, as I said, is from atherosclerosis or hardening of the arteries, which is a deposition of plaque inside the artery. And some of the risk factors for that are high cholesterol, high blood pressure, a strong family history of difficulty with arterial disease, and of course diabetes and smoking are probably two of the most important risk factors for that.
And so this disease can actually cause strokes then, is what you're saying?
That's correct. A stroke is sort of a heart attack of the brain. It's where the blood flow to a particular area of the brain is cut off, either by the artery completely being blocked or a plaque or a piece of blood clot breaking off that irregular diseased artery and going up to the brain and lodging in a smaller vessel. So it's analogous to a heart attack, only the symptoms are related to the area of the brain where the blockage occurs.
So is it just as sudden as a heart attack then?
Yes, it can be quite sudden and quite without any warning as well, which makes it so dangerous.
Can there ever be warning signs, though? I know with heart attacks, obviously, there are warning signs.
That's
but
correct.
Is there with stroke, too?
Yes, there are. We call those warning signs TIAs, or mini strokes, and these are related to tiny blood clots which lodge in the vessels temporarily and then break apart. And again, the symptoms they cause, which can be numbness or weakness, difficulty speaking. Sometimes it can simply be the inability to understand when somebody's talking to you. They usually last 15 or 20 minutes and go completely away. And that's a definite warning sign that patient is at high risk for a stroke.
So if that happens, obviously you want to go see your doctor right away, right?
Absolutely. It's very important to get in with your family physician or a vascular surgeon who takes care of carotid disease and get your carotid arteries checked.
All right, so a vascular surgeon takes care of carotid artery disease, so it's something that can be cured then by surgery?
Well, the disease process isn't cured, but we treat the blockages by opening up the arteries in a number of different ways. And also sometimes we use antiplatelet agents to prevent those irregular areas of plaque from forming blood clots, which can lead to strokes even if the arteries are open.
So when you do surgery, what exactly happens? Because surgery on arteries seems like it would be a pretty difficult thing. Arteries are pretty small, right?
Well, carotid arteries actually can be sizable to small. It can be very challenging at times. Basically, the standard operation is called a carotid endarterectomy, which simply is the term that means opening up the artery, taking out the plaque, and then closing the artery. We usually close it with a patch to make it bigger than it was before. But this operation has been performed for a very long period of time. It has excellent results. It's a very low-risk operation in properly selected patients. and it does a wonderful job in reducing the chance of a stroke in patients with that disease. In fact, it reduces the chance of stroke about 100 times in patients who have significant blockages greater than 70 or 80% of the carotid arteries.
So how are patients referred to you to come have that surgery? Have they had those warning signs ahead of time, or is it just something when they go in for their yearly checkup and they find out they have this disease?
Well, it can be a number of things. Some patients come in with the TIAs and are very concerned, and they've been referred to me by their family doctors. Other patients come in because a thorough physical examination was performed, which revealed either absence of pulses in the carotid arteries, or occasionally you can even get a funny noise called a bruit, which is a noise from turbulent flow that you can hear with a stethoscope applied to the neck. Or sometimes patients have a routine, because of a family history, have a routine ultrasound of the carotid arteries, which shows the blockage.
Now, when you call these bruits, that's what they are?
Bruits, correct.
So it's a sound in the neck, right?
Correct.
And describe to me what is that sound?
It's a whooshing sound, and it occurs when, as blood travels through a narrowed area of the artery, it has to increase velocity to get through. That's what the Doppler measures. And so after it gets through the narrowed area, it becomes turbulent, and you hear kind of a whoosh when you listen to the pulse in the neck.
You know, I think we've all been lying in bed, and maybe you hear, I guess, your pulse in your neck, right? But that's not a bruit.
That's
right?
correct. That's just hearing your pulse, and sometimes that can also be an indication of a problem if you have very high blood pressure, or some types of aortic valvular disease can cause that to be very prominent. But oftentimes people with bruits, when it's very quiet, usually just before they fall off to sleep, they can actually hear the whooshing noise. Some people call it a whistling noise or a whooshing noise in their neck.
So if you have that happen, see your doctor right away.
Very important to do that. That's correct.
So carotid artery disease, what are the risk factors? Is there something in diet? Should obviously exercise more?
Well, as I said, the big risk factors are high cholesterol, diabetes, smoking, a strong family history, and atherosclerosis or arterial disease elsewhere in the coronary arteries or in the legs. Those are the main risk factors. And certainly people who don't exercise, who do have those problems, have to be concerned about it. In terms of treating it, the disease is treated one way, but the prevention of the disease is really what we need to key on to make people really live longer, healthier lives. And that starts really with the basics: exercise, a healthy diet, watching your cholesterol and your blood pressure, trying to avoid the complication of diabetes by watching your sweets. And if you do have high blood pressure or a strong family history or high cholesterol, then it's really important to make sure you get treated for those conditions to minimize the effect on the arteries.
So those are all conditions that can lead to carotid artery disease.
Correct.
So Dr. Vuocolo, let's back up a little bit and talk about why is carotid artery disease so important?
Sure. Carotid artery disease is principally important because it leads to strokes. Strokes right now are the third leading cause of death in our country behind heart disease and cancer. Strokes are also the leading cause of disability, permanent disability in our country. Every year there's about 750,000 new strokes, and the lifetime risk of a stroke in a man is about 14% and about 16% in women. So it's a very significant disease in terms of the number of deaths it causes, the amount of disability it causes, and of course the pain and suffering that it causes.
Talk about the disabilities that stroke can cause. What kind of things can happen to people?
Yeah, well, strokes can be anything from a very minor disability to devastating. They can be complete paralysis of one side or the other, inability to speak, inability to understand. There's certain types of strokes which cause what's called a locked-in state, where people are awake, conscious, but can't move anything, although they can hear. So it can be very devastating.
And I would imagine stroke, it doesn't really matter what race, what sex, what age. It can happen at all of those?
Well, it usually happens as we age. Usually in the 60s or 70s is when the peak incidence is for stroke. It's more apt to occur in a female because they live longer than men. So it's more frequently seen in women. But usually it's in older age group patients.
So surgery for carotid artery disease, you've done this over 1,000 of these, right?
About 1,000. I kind of lost track after about the first 500. But as I said, the main surgery is the carotid endarterectomy, which is the tried and true procedure, and it works very well. There are some patients that are very high-risk patients, or patients that have had previous surgery on the neck, which make the risk of that surgery a little more than the standard, first-time operation. In those patients, we consider what's called carotid artery stenting, which is basically passing a catheter up through the femoral artery in the groin, all the way up into the neck, opening up the artery with a stent, and we use a little umbrella which we pass beyond the area that we're opening up to catch any debris that comes off the artery walls as we're opening up those relatively stiff and calcified arteries.
So how are you able to see into that artery? Is there a little camera?
Well, angioscopy is putting a camera into vessel. We usually don't use that. It's very difficult to get a good picture. We do it with X-ray guidance. We inject dye and we can see the catheter moving on a fluoroscopy inside the artery.
It sounds like such a difficult process, but you say the risk factors are very low.
Well, the risks are low of the procedure in properly selected patients. The important thing in anybody with carotid disease is to make sure they don't have disease in their heart as well. As I said, they go hand in hand. It's the same disease process. Once you select your patient properly and make sure their other medical problems are taken care of, the risk is very low. It is a fairly complicated operation, but it's a very standardized one, and it is one that takes a little bit of attention to detail, more so than your typical appendectomy type surgery, but the results are great.
And these are very small stitches, I'm assuming, very miniature surgery?
Yeah, the suture that we use is finer than the human hair, and the needles are just about 3 or 4 millimeters in length. When I was younger, I didn't need to use any magnifying glasses, but now I use loupes that magnify the field about 4.5 times, and it's a little bit easier to work under that magnification.
And we talked about buildup in the carotid artery disease. This is buildup of plaque, but that's not plaque on your teeth. The same kind of plaque, right?
Right. They're both called plaque. It's a totally different type of plaque. It's just a deposition of cholesterol and other calcified substances on the artery wall, on the interior of the artery wall. And of course, the more layers of deposition, the narrower the artery gets. All
right, so quick summary here. If folks want to prevent carotid artery disease, what do they need to do?
Most importantly, follow up with your local family doctor and make sure that you have a thorough physical exam. Make sure that if you have any of the risk factors, high blood pressure, diabetes, high cholesterol, you treat those well. Of course, watch your salt, exercise regularly, watch your diet. And those are really the main things we can do to reduce the chance that we're going to get a significant amount of plaque building up in the carotid arteries.
All right, fantastic. Dr. Philip Vuocolo, General and Vascular Surgeon at Fairmont Medical Center and also President and Chief Executive Officer. Thanks for joining us.
My pleasure, Jason.
Speaking of Health.
My pleasure, Jason. Thank you very much.
And now we'd like to give you a quick update on what's going on at Fairmont Medical Center. Starting with Tuesday, February 24th, the Cancer Support Group is meeting at the Fairmont Medical Center main classroom at 4 in the afternoon. The speaker is Vicki Rosenberg, an ovarian cancer survivor. She'll be talking about how to find the yellow brick road in your cancer journey. Registration is not required and refreshments will be served. Thursday, February 26th, is the Speaking of Health public program. Fairmont Medical Center OBGYN Dr. John Canieres. He'll be talking about stress and in particular how it affects women's health choices. That's Thursday, February 26th at 7 o'clock in the Fairmont Medical Center main classroom. It is a free presentation and registration is not required. There will be door prizes and refreshments will be served starting at 6:30. And we want to remind everyone that Fairmont Medical Center continues to provide free blood pressure screenings to the public as a community service. That's every Wednesday from noon until 1 o'clock in both the Fairmont Hospital lobby and the lobby at the Sherburne Clinic. And that's all the time that we have. Thanks for joining us today on Speaking of Health. And thanks to our special guest, Dr. Philip Vuocolo, General and Vascular Surgeon at Fairmont Medical Center, and also President and Chief Executive Officer at Fairmont Medical Center, part of Mayo Health System. Have a great day, everyone, and be healthy.